Today we will discuss dysarthria, one of the most important bedside neurological signs. Unlike aphasia, dysarthria is not a disorder of language. It is a motor speech disorder. Dysarthria is not a disorder of language. It is a motor speech disorder. It is caused by weakness, incoordination, or abnormal control of the muscles involved in speech production. So, why this dysarthria? It is because of the weakness, incoordination, or abnormal control of the muscles involved in speech production. Aphasia, what to say? Dysarthria, how to say it? So, speech production requires respiration, articulation, phonation, and resonance. So, for speech production, what does it require? Respiration, articulation, phonation, and resonance. Normal respiration, breath support, muscles of articulation or labial, lingual, and palatal muscles. Phonation is by larynx and resonance is by nasopharynx. So, production of sound requires normal respiration, muscles of articulation, labial, lingual, and palatal muscles. Phonation is by larynx and resonance is by nasopharynx. So, articulated sounds. So, what are the articulated sounds? Labial sounds. B, P, M, W. So, these are all labial sounds. So, test with pa, 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 or my baby bought butter. My baby bought butter. So, you can see all the articulated sounds, these B, P, M, W. So, all these my baby bought butter, pa, 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 pa. So, all these are labial sounds. And labiodentals are F and V. Labiodentals are F and V. Fa, fa, fa. Linguals or alveolars. So, these are these linguals are T, D, L, R, N. Test with ta, 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 la, la, la. Linguals, tongue action is there. Lingual means tongue action. T, D, L, R, N. Test with ta, 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 la, 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 ta, ta, ta. Dentals or palatals. S, Z, sh, sh, J. Gutturals or kha, kha, gha, ga, kha, kha, kha. Guttural sound, kha. Okay. So, distorted labials. Press upper and lower limbs together, hold and say, my baby. Distorted linguals. Tip of tongue to back of lower teeth, hold and say, top dog, go jump, train. Okay. So, diadochokinesis. Ask the patient to repeat rapidly. Pa, 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 lips. Ta, 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 tongue. Ka, 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 palate. Pa, ta, ka, coordination. Okay, for diadochokinesis, ask the patient to repeat rapidly. Pa, 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 lips. Ta, 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 tongue. Ka, 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 palate. Pa, ta, ka, coordination. For clinical examination, listen to spontaneous speech. Note the quality, rate, volume, articulation, and resonance. Assess articulation, rate, rhythm, pitch, loudness, and prosody. Examine face, palate, and tongue. Perform rapid syllable repetition. Ask the patient to read a sentence. Count from 1 to 10 and sustain test gag reflex when indicated. Types of dysarthria. So, in the types of dysarthria, we have a flaccid, that is element type of dysarthria. So, this is a breathy nasal speech. So, here there is a tongue wasting, fasciculation. So, causes are bulbar palsy, brainstem stroke, and motor neuron disease. Flaccid element type, breathy nasal speech, tongue wasting, fasciculations. Causes are bulbar palsy, brainstem stroke, and motor neuron disease. Spastic is bilateral upper motor neuron type, slow strained hot potato speech, brisk jaw-jerk, and pseudobulbar palsy. Ataxic cerebellar, scanning speech, irregular rhythm, and variable loudness. Hypokinetic, Parkinson's disease. So there will be hypophonia, monotone speech, short rushes, and festination. Hypokinetic speech, bradykinesia, rigidity, and all will be there. Clinical features. So speech characteristics: monotone, monoloud, reduced stress, short rushes of speech, and reduced initiation. Ataxic cerebellar speech. So it is a scanning speech, that is irregular breakdown of all sounds, especially multisyllabic words. Flaccid labials, B, P, M, W, slurred, slow, imprecise articulation. Hypokinetic, hyperkinetic. So this hyperkinetic type of speech is seen in chorea, dystonia, Huntington disease. So here you have this involuntary movements and poor control of articulation. Myasthenic fatigable speech, worsening with prolonged speaking and improving after rest. So this is myasthenic. Normal at first, becomes slurred and nasal, weakens with repetition, all sounds affected as fatigue sets in. Flaccid speech, spastic speech, ataxic, hypokinetic, hyperkinetic. Hypokinetic whenever a patient has got Parkinsonism. Ataxic whenever a patient has got cerebellar disorder. Spastic in upper motor neuron type, pseudobulbar type. Flaccid in element weakness or paralysis of lower motor neuron type. UMN and element dysarthria. So in UMN dysarthria, lesion is above the nucleus, corticobulbar tract. Element dysarthria at nucleus or peripheral nerve, cranial nerves. So the muscle tone, it is spastic. Element flaccid. Reflexes are exaggerated. Reflexes are reduced or absent in element. Fasciculations are absent in UMN. Fasciculations will be present in element. Atrophy absent, atrophy present in element. Speech is strained, slow, effortful and spastic. Element, it is slurred, nasal, weak and breathy. Voice is loud and harsh. Element soft and breathy. Nasal speech mild or variable. Element type, it is prominent. No fatigability in UMN. Fatigability in some element causes. So the clinical pearl is localized dysarthria as spastic, flaccid, ataxic, hypokinetic, hyperkinetic or fatigable, then correlate with cranial nerve findings. So bedside sequence: first listen, then inspect, pa, ta, ka, read, count, sustain, so this is the key to testing speech. Dysarthria means it is a motor execution problem of speech, not language. Aphasia, language disorder, comprehension or expression. Careful bedside testing localizes the site and type of lesion. So what are the tips for examination? Quiet environment. Ask patient to sit upright, speak clearly, use short instructions and compare with normal speech if available. So labials are B, P, M, W. Modified labials are O, U. Labiodentals F and V. Distorted linguals, distorted labials. Linguals T, D, L, R, and Tata. Dentals or alveolar sounds S, Z. Okay, so first remember labials. Pa, pa, pa. Linguals ta, ta, ta. Pa, pa, pa. Ta, ta, ta. Gutturals kha, kha, kha. So those are gutturals. Labials are pa. Okay, linguals are ta. Gutturals are kha. Okay.